Within every woman's body, hormones act like silent conductors of a grand orchestra, directing everything from reproduction and menstrual cycles to the skin, hair, and even emotions. But what happens when that orchestra falls out of tune? When the melodies that were once harmonious start to sound chaotic? That's when polycystic ovary syndrome begins to make its presence known. PCOS isn't a rare condition, but it's a silent shadow that millions of women live with daily, many without even realizing it. Statistics show that between 6% to 12% of women of reproductive age suffer from this syndrome. Yet many go undiagnosed, unaware that the subtle changes in their bodies are warning signs of an ongoing hormonal battle. So, what exactly is PCOS? It's a chronic endocrine disorder where the ovaries produce an excess of male hormones, androgens. This hormone imbalance disrupts ovulation, the process that normally releases a mature egg each month, leading to irregular or absent periods and making it harder to conceive. Instead of releasing eggs, the ovaries form multiple small follicles, like immature eggs that never develop, creating the characteristic polycystic appearance. But PCOS is not just about missed periods. It is a systemic disorder that impacts the whole body, from persistent acne and oily skin to excess hair growth on the face, chest, or abdomen, and even male patterned hair thinning on the scalp, all caused by high androgen levels running wild in a woman's system. Beneath stubborn belly fat that resists diet and exercise often hides another common PCOS trait: insulin resistance. Insulin, the hormone that regulates blood sugar, becomes less effective, prompting the body to produce even more. This not only causes weight gain, especially around the abdomen, but also pushes the ovaries to produce more androgens, creating a vicious internal cycle. PCOS is also the leading cause of infertility related to anovulation. Many women only discover they have it after months or even years of unsuccessful attempts to get pregnant. At that point, the emotional toll of frustration, self doubt, and invisible pressure becomes just as heavy as the physical symptoms. But the consequences of PCOS go far beyond fertility. Left unmanaged, it opens the door to a host of serious health risks: type 2 diabetes, high blood pressure, elevated cholesterol, cardiovascular disease, depression, and even endometrial cancer, especially if long term missed periods go untreated. And yet, the most crucial message is this: PCOS is not a life sentence. With early detection and the right treatment, women can live healthy, fulfilling lives. The key lies in listening to your body, making sustainable lifestyle changes, and choosing treatment paths that match your personal goals, whether that's regulating your period, reducing acne, or embarking on a journey to motherhood. Polycystic ovary syndrome may be silent, but it is not powerless. It simply calls for deeper self understanding so that every woman can take the baton back into her own hands, restore harmony to her hormonal symphony, and compose a full, vibrant score for her well being. PCOS is far from rare. In fact, it is one of the most common hormonal disorders affecting women of reproductive age. Yet, ironically, most women with PCOS are unaware they have it, despite the condition's serious impact on health, fertility, and overall well-being. According to major health organizations such as the CDC and WHO, between 6% and 12% of women of childbearing age, 15 to 44 years old, live with PCOS. That means at least 1 in 10 women is affected. In certain countries or ethnic groups, especially where obesity, sedentary lifestyles, or family history are more common, the rate may be even higher. But here's what's more alarming: over 50% of PCOS cases go undiagnosed. Why? Because the symptoms of PCOS are often subtle and easily mistaken for other issues: stress, temporary hormonal changes, or even just prolonged puberty. An irregular period, a few stubborn pimples, or some extra hair growth, these are easy to dismiss. Yet for the female body, they could be silent cries for help. Furthermore, the stigma around gynecological exams, limited awareness of reproductive health, and the absence of a single definitive test for PCOS all contribute to a delayed diagnosis. Many women only discover they have PCOS after experiencing complications, infertility, metabolic disorders, type 2 diabetes, or unexplained weight gain that refuses to budge. This all paints a clear picture. PCOS is not just a personal problem, it's a public health issue. If left undetected and untreated, its consequences go far beyond hormonal imbalance, leading to a significant decline in quality of life. Anxiety, depression, low self-esteem, difficulty conceiving, and long-term chronic illnesses. However, this bleak reality also reveals a powerful opportunity. We can change the narrative through awareness, education, and empowering women to listen more closely to their bodies. When we truly understand how widespread and impactful PCOS is, we can start treating it with the urgency and care it deserves. When PCOS quietly enters a woman's life, it doesn't arrive with loud warning bells, but rather slips in through the smallest changes, ones that seem harmless, yet carry powerful messages from the body. The first symptoms are often subtle and easy to dismiss. A menstrual cycle that's a few weeks late or disappears for months is frequently blamed on stress, lifestyle changes, or minor hormonal imbalances. But this is already a sign that ovulation has begun to malfunction. The ovaries are no longer releasing eggs on schedule, disrupting the reproductive rhythm and causing the uterine lining to grow out of sync. Over time, the risks of infertility and endometrial cancer quietly rise. Alongside this, the skin often begins to react. Persistent acne, especially along the jawline, chin, and back, areas sensitive to male hormones, androgens, becomes a frustrating norm. Many women face an even more distressing reality: unwanted hair growth on the face, chest, or stomach, while the scalp thins in a pattern resembling male baldness. These are telltale signs that the body is producing excessive androgens. Another commonly overlooked symptom is abdominal weight gain. Even without dietary changes or despite strict diets, weight continues to rise, particularly around the midsection. Beneath this is often insulin resistance, where the body struggles to regulate blood sugar, leading to fat accumulation and increasing the risk of dangerous metabolic disorders. But PCOS isn't just physical. It also takes a toll on emotional health. Changes in appearance, anxiety over fertility, chronic fatigue, and sleepless nights gradually wear down confidence and energy. Many women slip into depression or anxiety without realizing that hormonal imbalance is at the root. Not all women display every symptom. In fact, some may show only one or two. Yet, if at least 2 out of the following 3 signs are present, PCOS is a strong possibility. 1. Irregular or absent menstrual periods. 2. Elevated male hormones, manifesting as acne, excess hair, or hair loss. 3. Multiple small follicles on the ovaries seen via ultrasound. What's most important to understand is that every woman's PCOS looks different. There is no one size fits all. That's why learning to read your own body's signals is the key to early detection and effective treatment. After understanding the symptoms, many women begin to ask the inevitable question: why me? What caused my body to change like this? Unfortunately, the answer isn't simple. PCOS is a complex syndrome with no single cause, arising instead from a multifaceted interaction between genetics, hormones, and modern lifestyle factors. One of the most well-established contributors is genetics. If your mother, sister, or another close female relative has PCOS, your own risk increases significantly. Studies have identified gene variations linked to sex hormone regulation, insulin sensitivity, and fat metabolism,
all of which commonly appear in women with PCOS. The second major factor, just as critical, is insulin resistance. When your body's cells become stubborn and stop responding effectively to insulin, the hormone responsible for helping glucose enter cells, the pancreas compensates by producing more insulin. This excess insulin unfortunately creates a dual problem. It stimulates the ovaries to produce more androgens, disrupting ovulation, while also promoting fat storage around the abdomen and increasing the risk of type 2 diabetes. From this imbalance, a silent, persistent, vicious cycle is born. Adding to this, researchers have found that many women with PCOS also exhibit chronic low-grade inflammation. This internal state of silent inflammation, marked by elevated markers like CRP and cytokines, can further stimulate the ovaries to produce more male hormones than normal. Furthermore, today's fast-paced world contributes its own share of risk. A sedentary lifestyle, high intake of refined carbs and unhealthy fats, poor sleep, and chronic stress all disrupt the brain-pituitary-ovary hormonal axis, making PCOS symptoms worse and more difficult to manage. And here's a crucial truth. PCOS is not your fault. Your acne, weight gain, irregular periods, or fertility struggles aren't due to a lack of willpower. They're the result of your body battling a chaotic and overloaded hormone system. But by understanding these causes and risk factors, we gain the tools to fight back with intention. Through lifestyle changes, improved insulin regulation, reduced inflammation, and targeted hormone therapies, women with PCOS can not only regain control over their health, but also reclaim the power to live fully and freely.
After all the subtle signals the body has been sending, irregular menstrual cycles, persistent acne, increasing hair loss, one thing becomes clear. These are no longer isolated issues, but signs of a complex syndrome that must be called by its name. But how can one know for sure whether they are living with polycystic ovary syndrome, PCOS? Unlike some medical conditions that can be confirmed with a single test, PCOS requires a comprehensive diagnosis, combining clinical symptoms, blood tests, and ultrasound imaging. This complexity reflects the multifaceted nature of the syndrome. There's no one-size-fits-all pattern for every woman. Currently, the medical community widely uses the Rotterdam criteria, an internationally accepted diagnostic method. According to this standard, a woman is considered to have PCOS if she meets 2 out of the following 3 criteria, after excluding other potential causes. 1. Irregular or absent ovulation, often reflected in menstrual cycles longer than 35 days or complete absence of periods for months. 2. Signs of elevated male hormones, androgens, including persistent acne, excessive hair growth in unwanted areas, or scalp hair thinning. Blood tests may show elevated free testosterone levels. 3. Polycystic ovaries on ultrasound, typically showing 12 or more small follicles on each ovary, less than 9 millimeters in diameter, or increased ovarian volume. However, having multiple follicles on an ultrasound doesn't always mean PCOS. In fact, many healthy women, especially teenagers, may display a polycystic pattern without any hormonal disorder. Conversely, some women with PCOS may not show any distinct findings on imaging. That's why the heart of PCOS diagnosis lies in the blend of subjective experience and objective clinical evaluation. To achieve an accurate diagnosis, doctors often request a range of additional tests, including hormonal tests, LH, FSH, testosterone, prolactin, TSH, fasting blood sugar and insulin to assess insulin resistance, lipid profile to detect early signs of metabolic dysfunction, and pelvic ultrasound, either transabdominal or transvaginal, depending on age and sexual activity. It is essential to emphasize that an early diagnosis is the key to preventing future complications. Knowing you have PCOS gives you the clarity to begin your journey toward hormonal balance,
lifestyle adjustments, and protecting your fertility. A timely diagnosis is more than just a medical conclusion. It is a turning point of empowerment when a woman is seen, understood, and given the tools to care for her own body with confidence and control.
When a woman leaves the doctor's office with the diagnosis PCOS, polycystic ovary syndrome, the first feeling is often confusion. Many wonder, will I have to live with this forever? Or will I still be able to get pregnant? But here's the truth. PCOS may not be entirely curable, but it is absolutely manageable, and many women go on to live healthy, fulfilling lives when they take control with the right treatment strategy. Treating PCOS is not just about taking medication, it's about a holistic transformation. It involves adjusting one's lifestyle, nutrition, activity level, and emotional well-being, along with targeted medical interventions based on each woman's unique condition and personal goals. For many, the first and most crucial step is lifestyle change. Losing just 5 to 10% of body weight in those who are overweight can dramatically improve symptoms, restoring regular periods, supporting ovulation, reducing acne, stabilizing blood sugar, and lowering the risk of long-term metabolic diseases. A balanced diet, low in refined sugar, high in fiber, rich in vegetables and lean proteins, combined with regular exercise such as walking, yoga, or swimming, becomes the first true medicine the body craves. However, for women with more severe symptoms or for those trying to conceive, medical treatment is often necessary. Depending on individual needs, doctors may prescribe various medications. For regulating periods and reducing acne and excess facial or body hair, combination birth control pills are commonly prescribed to lower androgen levels and restore hormonal balance. When insulin resistance is a major concern, metformin helps improve insulin sensitivity, support weight loss, and restore menstrual cycles. For those trying to conceive, ovulation-inducing medications such as clomiphene citrate or letrozole may be prescribed. More complex cases may require assisted reproductive technologies, IUI, IVF. In some cases, spironolactone or cyproterone acetate may be used to manage hirsutism and persistent acne by blocking androgen effects. But no treatment plan is complete without addressing the mental and emotional aspects. PCOS doesn't only affect the body, it leaves behind emotional scars, low self-esteem, frustration over weight gain, fear of infertility, and feelings of being misunderstood. Psychological support, counseling, participation in support groups, or simply being heard plays a critical role in the healing process. What's most inspiring is that countless women have successfully managed PCOS and gone on to live vibrant, empowered lives. Many have become mothers, rebuilt their confidence, and embraced a healthier version of themselves. They are living proof that PCOS is not a full stop, but rather a comma, a turning point that leads to a new chapter where a woman learns to understand, care for, and truly love her body. PCOS doesn't strike like a heart attack or a stroke. It doesn't cause sudden pain that demands immediate hospitalization. And that, precisely, is what makes it so dangerous. Its silence is a double-edged sword, lulling many into neglect, until the damage is done and cannot be undone. When left unmanaged, PCOS goes far beyond irregular periods or persistent acne. Over time, it unlocks the door to a series of serious complications, hormonal, metabolic, and psychological, that can affect a woman's quality of life on every level. One of the most immediate and painful consequences is infertility due to lack of ovulation. As the ovaries lose their regular rhythm, eggs fail to mature or be released, making conception difficult or even impossible without medical assistance. Many women only discover they have PCOS after years of trying to get pregnant, often when their most fertile years have already passed. But fertility is just one part of the picture. Insulin resistance, a core issue in PCOS, is a fast track to type 2 diabetes. Over time, the body's excess insulin disrupts blood sugar control, damages blood vessels, and dramatically increases the risk of cardiovascular disease. Women with untreated PCOS also face heightened risks of high blood pressure, abnormal cholesterol levels, high LDL, low HDL, non-alcoholic fatty liver disease, NAFLD, and metabolic syndrome, a cluster of conditions that increase chronic disease risk. Another silent but deeply concerning complication is endometrial cancer. With prolonged menstrual irregularity, the uterine lining isn't shed regularly, leading to abnormal overgrowth. Over time, this unchecked buildup can develop into precancerous changes and eventually into cancer itself. And let's not forget the psychological toll. Women with PCOS often suffer from poor body image, anxiety, and depression, especially when facing issues like infertility, severe acne, hirsutism, or uncontrollable weight gain. When these struggles are downplayed or unsupported by society or family, emotional health steadily deteriorates. Yet, there is hope, and a powerful one. These complications are not inevitable. With early detection and consistent treatment, they can be prevented, minimized, or even reversed. Listening to your body, seeking medical advice when something feels off, and committing to lifestyle changes are acts of self-care that do more than preserve health. They reclaim vitality, confidence, and control.